opioid epidemic. It started in the mid-1990s. If you look at all the statistics in regards to the overprescribing of opioids and the increase in the use of heroin, et cetera, it starts in the mid-1990s. And there were basically four things that happened in the mid-1990s. They were not done strategically together, but in retrospect, it definitely happened to be strategic. The first one was that doctors were accused of undertreating pain. In fact, some doctors actually were sued for having undertreating pain. Pain's been part of the human condition since the history of man. The United States is not unique in having pain, acute pain, subacute pain, or chronic pain. The World Health Organization did a study several years ago and found that about a third of the population in developed countries have chronic pain. So chronic pain is not unique to the United States. The second thing that happened in the mid-1990s was the introduction of non-addictive prescription opioids. And I use air quotes specifically because they were marketed as not being addictive, that there was less than a 1% chance that people could get addicted to these particular prescription opioids. They were the magic pill, and they would help doctors properly treat pain. That message of non-addictive prescription opioids and that opioids had been underutilized in the management of pain was inculcated in medical schools, in education for doctors throughout the United States. At the same time, again in the mid-1990s, pain was added as the fifth vital sign. You and I know that pain is completely subjective. It's not as objective as blood pressure or pulse rate, but yet it is treated as such. One of the first things you're asked when you go see a doctor is, what is your pain on a scale of 1 to 10? Frowny face, smiley face. Oftentimes, we kind of overestimate maybe our pain. There are some people that don't have great pain thresholds, don't have high pain thresholds, and somewhat relatively not that big of a pain, they say it's a 10, whereas other people have high pain thresholds and very substantial pain, and they say it's a 5. It's very, very subjective, but that was incorporated in the Joint Commission. A variety of different people said pain needed to be one of the vital signs. Actually, the Joint Commission has backed off of that. The American Medical Association has backed off of that and go, you know what? We may have created more issues than we saw by asking for pain because it is so subjective. So that was the third thing. The fourth thing was the use of Press-Ganey patient satisfaction surveys. That's where patients were asked, how do you feel about your doctor and the treatment that you got? Much like apps that you use to gauge your restaurant and your airline experience. Same thing with doctors. I've seen studies that show that doctors treat towards that. One of the worst things that can happen to a treating physician is for a patient to come in with 20 pages of printed material from WebMD that describes exactly what their problem is. They have diagnosed themselves. And oh, by the way, that while they were printing that stuff, they were listening on the TV to commercials that said the purple pill, the brown pill, and the yellow pill will solve all their problems, and they bring that in with them to the doctor's office. The doctor is really put in a very difficult circumstance in that regard. In fact, they may have to be the one to actually share, not only did you not get the diagnosis right, but you don't need those pills. Those pills could actually cause more problems. So what do? They walk out without getting what they thought they needed, and they write a negative satisfaction survey on that. There's been studies that show that doctors change their treatment patterns based on what's being said about them, because sometimes those patient satisfaction surveys have impact on their ability to increase their stature in the organization, maybe become the assistant medical director or the medical director. It may incorporate and deal with their compensation. There's a lot of stuff that's going on. So those four things happened in the mid-1990s. It's been discussed that in 2016, 2.1 million people aged 12 or older had some form of opioid use disorder. I don't know what you were doing at age 12. I pretty much still was eating dirt and thought girls had cooties. But all the statistics in regards to substance use disorder, opioid use disorder, start at age 12. 2.1 million Americans age 12 or older have some kind of opioid use disorder, which includes not only prescription opioids, but the illicit opioids like heroin and fentanyl and other things on the street. So in 2017, the CDC says that 72,000 people in America died from drug overdoses. That's the preliminary numbers that were announced in August. I'm sure that that number may gravitate one way or another. Usually they're pretty dead on, but they don't announce the final statistics until November. If statistics hold, historically about 2/3 of drug overdose deaths have been related to opioids. With 72,000 dead, that would translate into about 47,000 people, Americans, our fellow citizens, that died because of an opioid overdose. That's about 131 per day. Think about that, 131 per day, every day, for 365 days a year, died from opioid overdoses. That represented a 10% increase from 2016. So there's a nuanced issue associated with the opioid epidemic, though. At the same time as opioid prescribing has been declining, overdose deaths are increasing. That doesn't make sense. If we're prescribing less opioids, that should mean that we have less overdose deaths, but we actually have more. And the reason is that we have transitioned the opioid epidemic into very dangerous and more potent illicit drugs. So in my opinion, the opioid epidemic started with the overprescribing of opioids in the mid-1990s. That transitioned into those same prescription opioids making their way onto the street. That could be from buying medications from someone. That could be going into a medicine cabinet and taking medications from someone. I read a story about a year or so ago that said that real estate agents are actually using the benefits of the lockbox access in order to access medicine cabinets to feed their habit, and maybe potentially selling it or using it. So it went from prescription opioids prescribed by doctors to prescription opioids that were then resold on the street, and then it transitioned into heroin. Because what happened is that the prescription opioids were expensive, and their dealers would tell them it's actually less expensive and you'll get more bang for your buck if you use heroin instead. And that's why when you look at the mid-1990s, there was a surge in heroin, a resurgence in heroin use. It was because people were transitioning from the prescription opioids that they either secured from a doctor or bought on the street, and they became too expensive, or they couldn't get their doctor to prescribe them anymore, and they said, I still need that heroin type high, and so might as well go to heroin and get that done. But that wasn't enough. Heroin is only 5 to 10 times more potent than morphine. Fentanyl, on the other hand, is 50 to 100 times more potent than morphine. And that transition happened about 4 years ago. So people were using heroin, but heroin to the dealers was more expensive than the synthetic fentanyl. Now, this is not the fentanyl that you use for hospice care that women have in their intrathecal pumps associated with childbirth. This is fentanyl that's oftentimes manufactured in China and shipped directly through the United States Postal Service, or shipped to Mexico, reconstituted, and transported over the border. Fentanyl, this kind of fentanyl, is 50 to 100 times more potent than morphine. You can see the evolution. Oxycodone is only 1.5 times more potent than morphine. Heroin, 5 to 10 times. Fentanyl, 50 to 100 times. And then we got into carfentanil, which is also known as the elephant tranquilizer. It's 10,000 times more potent than morphine. In Appalachia, in the Northeast, we saw the introduction of carfentanil. One tiny grain of salt size of carfentanil is enough to kill you. So the opioid epidemic has transitioned to more and more dangerous, more and more potent, and more illicit drugs over time. So when you go, prescribing is down, but opioid overdoses is up, that doesn't make sense. It does make sense if you understand the evolution of the epidemic. Now, some have told me, and I've read this on Twitter and on social media and in articles and stuff, that this whole opioid epidemic is overblown. It's not really an epidemic. It's a small number. It's a rounding error. Yes, it's 1%. Maybe it's 0.1%, 5%. We don't know. It's not that big of a deal. But if it's your mother, if it's your father, if it's your sister, your friend, or your colleague that died, the opioid epidemic is real. It has hit the United States in full force. I mentioned earlier that about a third of the developed countries' population have chronic pain. The United States uses 80% of all opioids on planet Earth and 99% of all hydrocodone. We're not dealing with pain properly. And that's what we're going to talk about as we continue this discussion on pain management.